Best wishes, doctor. Okay.
So നമുക്ക്
ഈ
ലൈവ് കട്ട് ചെയ്യുമ്പോഴേ ചാടി പോയേക്കരുത്. ഒരു 5 മിനിറ്റ് നിന്നേക്കണം കേട്ടോ.
So best wishes. Thank you.
Miss live ആണ്.
Okay. Start.
Goldie.
Yes, ma'am. Good evening and a warm welcome to all. I am Goldie Sarah Sunny from first year psychology, welcoming you all to the 9th session of the Sci Hub, the international webinar series organized by the Postgraduate Department of Psychology, Kottayam College of Management and Technology in association with Internal Quality Assurance Cell. Just a little instructions before we begin with. Please mute yourself to keep the quality of sound functional during the meeting. If you have any questions during the presentation, please type them into the chat box, which will be clarified during the question answer session. The feedback form will be shared in the chat window. E-certificate will be provided after the submission of the feedback form. Now, without any further ado, let's move on to our session. Prayer should not be regarded as a duty which must be performed, but rather as a privilege to be enjoyed, a rare delight that is always revealing some new beauty. I call upon Selsha Rajan from first year psychology for the prayer song.
Am I audible?
Yes, Selsha, you're audible.
Light of the world, you step down into darkness. Open my eyes, let me see beauty that makes this heart adore you. Hope of a life spent with you. Here I am to worship, here I am to bow down, here I am to say that you're my God. You're altogether lovely, altogether worthy, altogether wonderful to me.
Thank you, Selsha. Now I invite Ms. Luna Johnny, Assistant Professor of the Department of Psychology, to deliver the welcome speech.
Thank you, Goldie. Am I audible?
Yes, ma'am, you're audible.
Okay, thank you. A dream written down with a date becomes a goal. A goal broken down into steps becomes a plan. A plan backed by action makes your dreams come true. Good evening, everyone. I'm extremely overwhelmed to welcome you all to the 9th session of our international webinar series, Sci Hub, organized by the Postgraduate Department of Psychology, Kottayam College of Management and Technology, in association with IQAC. First and foremost, I welcome our resource person of today's session, Mrs. Divya K. Thomas, Clinical Psychologist, Rajagiri Hospital, Kochi. Ma'am, with immense admiration and affection, I welcome you to the webinar. Let me now welcome the man who doesn't need any introduction and known among all of us for his wisdom and knowledge, our beloved principal, Reverend Father Joshi Chiramkuri CMI. Acha, with a thankful heart, I welcome you to this webinar. It's my privilege to extend a warm welcome to the man with a deep sense of commitment, our Vice Principal, Dr. Verghese Anthony, to this webinar. Welcome, sir. Next, I welcome the genius behind the whole series and our constant support system, Dr. Angel Thomas, HOD of Psychology Department, to this session. Welcome, Miss. Now, I would like to welcome the IQAC coordinators of our college, Dr. Sushil Joseph and Dr. Anu Hani, to the webinar. I extend a warm welcome to all the HODs of various departments and the teaching fraternity of our college to this session. Finally, yet importantly, I welcome all the participants who have joined with us this evening. It's a pleasure to have you all with us. I once again extend a warm, cordial, and virtual welcome to each one of you. Thank you all. Over to you, Goldie.
Thank you, ma'am. May I now request Neha Abraham from first year psychology to introduce our speaker, Ms. Divya K. Thomas.
Good evening all. I'm extremely happy and privileged to introduce Mrs. Divya K. Thomas, the resource person for International Webinar Series, Sci Hub Session 9. Mrs. Divya K. Thomas, who has an MPhil in Clinical Psychology, has been working in Rajagiri Hospital since 2015. She is also associated with National University of Advanced Legal Studies as a visiting consultant. She earlier worked at NIMHANS Bangalore, Lutz Hospital Ernakulam, and SH Hospital Pine. Family across the lifespan: child, adolescence, marriage, parenting, and old age. Health psychology, neuropsychological assessments, and cognitive retraining are her areas of interest. She is a volunteer for suicide prevention team and COVID-related psychological support team initiated by Indian Association of Clinical Psychologists Kerala region. She worked as a senior research fellow, the first project in India on an exploration of behavioral addictions under Dr. Manoj Kumar Sharma, Professor of Clinical Psychology, NIMHANS in 2012-2014. She has 7 research papers in international journals on various behavioral addictions. One among the outcome of this study was the introduction of Shut Clinic, a walk-in center at NCWB NIMHANS, a service for healthy use of technology. She is actively involved in mental health awareness and training programs. It's truly an honor to have you with us, ma'am. Thank you.
Thank you, Neha. Now I invite Ms. Divya K. Thomas to begin the session, Gaming Disorder, Future of the Newgen Trend. Ma'am.
Thank you all. First of all, I would like to thank Angel Madam, Dr. Angel, who was my senior for our MPhil program, and all the organizers for this wonderful opportunity to chat with these youngsters who are very keen in knowing about a lot of psychology concepts, and that is why I think this concept of Psych Hub might have emerged. And thank you very much, madam. So, and the topic which you have chosen today is such a very relevant and what to say, it is a boom, right? And we all don't know how to intervene in this, in this sort of addictions. And let us see what can be done. Let us share or let us discuss each other. What are the different strategies which we can implement to make sure that it should not be an addiction for many. Sorry. So let me start with this presentation. I hope it is seen, right? Oops.
No, it is not yet.
Yeah, it is, right?
Please share your screen.
Yeah, shared. Is it seen? No. Yes, share.
Your presentation is not yet.
Yeah, it is. It's seen? Yes, it's seen. Yeah,
Yes.
Okay, all right. So, nowadays, many of us are in a situation wherein we all are like this. We all work, we reach home, again we work, then we reach to a very tiring situation. We become tired, and look at the posture, and ultimately then when we go to sleep, again thinks about the next day or the plan or things we have already discussed or which we have already seen. The visuals will be there in our mind, in our brain, and then we'll go to sleep. This is mostly the pattern, and in this single picture itself, it is very clear the physical distress due to internet use. I'm not talking about even the abuse. Then the psychological processes, the thought, the sleep deprivation, all these are very well depicted in this very simple picture. So can you say that this internet use is just Just, is it abnormal? Can we say like that? No, not at all. Because in this modern society, as you all know, it is totally unreasonable to expect that anyone is completely have to abstain from what do you say, the internet use, or maybe in all aspects. See, we also are using all this, but so we do not want to pathologize a normal behavior. Therefore, when can we say that it will become an addiction? Before that, let us talk about behavioral addiction. This is actually a new term, might have emerged around a decade back, around 2010, 2012. This is behavioral addiction is otherwise known as process addiction, and these are very similar to other substance or alcohol addiction, wherein the person has very difficult or multiple adversive consequences because of that. And this is an umbrella term. Internet or video gaming addiction is one among them. This spectrum, one among this spectrum. And as very common, it is the prevalence rate is very high. And other behavioral addictions, I think you should also be aware about other internet addictions also. I mean, other behavioral addictions also, like you may wonder, like work addiction, then exercise addiction, eating addiction, then internet, social media addiction, TV, phone, sexting, online shopping, gambling, pathological gambling. All these comes under the other behavioral addictions. I am very well, why I am saying this with a little bit of authenticity is because in a project, in an ICMR project conducted by NIMHANS, ICMR funded project by NIMHANS in published in 2013. I was also part of that project as a senior research fellow, and we could identify among the Bangaloreans, the urban population of Bangalore, the prevalence rate of these behavioral addictions are very high. It was very one among the first study of about this addictions, and that time it was in 2013. The prevalence rate was around 7% of people in Bangalore had this different sort of behavioral addictions. It was in 2013, and years have passed, and we should know how much will be the prevalence. Yeah. Then coming to internet addiction types, different types. This because this video game addiction is one among internet addiction. There are different types of internet addiction as such: video game, then surfing, online gambling, shopping, then sexual addiction, cyber. This is spelling error, I think. Yeah, cyber sexual addiction and relationship or social networking sites addiction. All these are, you see, look at the picture. These are not tablets, right? These are not capsules, but all are connected to internet icons or symbols. Yeah. So when this become a normal pattern of behavior, will become an abnormal condition when the internet or video gaming disorder occurs, then there is an issue with the functioning of any of these areas, like one is relationship, then work, then mental or physical health, any of these areas. Therefore, we can consider it as an addiction. Coming to the definition or how it emerged, gambling disorder. Previously, before I would say, I have to say that this in ICD-10, ICD-11, it is considered as a specific disorder of gaming disorder. Before that, 1 year before that, DSM-5, they considered gaming disorder as IGD, internet gaming disorder. And after 1 year of consideration, WHO decided to include gaming disorder as part of ICD. So it is otherwise known as digital gaming or video gaming, characterized by impaired control over gaming, increasing priority given to gaming over other activities, to the extent that gaming takes precedence over other activities and daily activities, and continuation or escalation of gaming despite the occurrence of negative consequences. Yeah. And this should happen, or this should be continuing, and it will affect the other areas of functioning of the individual, like families, personal, social, educational, occupational, all the other areas for the last 12 months. Therefore, this can be considered as a disorder according to ICD level. And why in ICD? That is a question, because it is not a very common disorder as other disorders described in ICD. Why? The inclusion has emerged, like when they looked at different healthcare professionals, it was saying that when they included different treatment programs for people with health conditions, identical to those characteristics of gaming disorder in many parts of the world, and it resulted that there is an increased attention for the healthcare professionals itself to have risk of development of this disorder, and that is how it emerged as a disorder itself. And therefore they thought it is there is definite prevalence and need preventive strategies. Right. Now, about prevalence of video game or internet game disorders, in many studies, I haven't quoted any of the studies, but overall, if you look at the studies, there are a lot of inconsistencies in the results, because they say it is not, even now, many studies are not complete, because this 12-month duration of this condition is not studied in many of the many of the researches, but still overall population based cross-sectional studies showed that around between 6 and 23% is the prevalence rate in different studies. And demand survey, which we did in 2013, published in 2013, the period of the survey was 2012 to 13. It showed that 7% of the people have internet addiction. Overall behavioral addiction. Among them, 7 have again internet addiction, and 2% specifically have video game addictions, which is a very, very scary result. And about the risk factors involved, let us think about gender. Can anyone say, can you just think about who is more prone to gaming, or who are more gamers? Our answer definitely must be males, but the studies again indicate that it is not like that. Females are mostly involved in shopping, or games like puzzle gaming, or family games, wherein males are mostly involved in racer or other fighter games. But when we say the prevalence, this is almost equal. But at the same time, males are more identifying themselves as gamers. This is the difference. Males are more likely to identify themselves. They are more interested to show themselves as gamers. And the other factors include, this reward, again, there is one, D is missing, I think, sorry. This dopamine deficiency, the reward deficiency syndrome. That is one risk in this gaming addiction, similar to all other addictions. Why it is happening? There is the neurobiology. And low emotional well-being. Those who have very low emotional well-being are very prone to these sort of addictions. Then comorbidities, definitely other addictions as well, other behavioral addictions. The chance of other behavioral addictions are again are also one another risk factor to involve into gaming addictions. Family dysfunction, conflict in family, today I have seen one. I mean, just now I have completed one case. When client, I just discussed with the client that he was involved into gaming for more than 8 hours a day, and there was definite family pathology, definite family parental conflicts, and he was trying to come out of it through this sort of loofing himself into gaming. Then content factor, that means the content, what is highlighting in these games and how interesting are they. This will definitely this is definitely a risk for these games. Plus time factor, how long are they sitting alone, then where are they sitting. All these factors are, and how long are they exposed to internet. All these factors are risky. This is just a case. uh, this is a case which is actually resolved, and we should see the family impact also. He's an 18-year-old boy who had previously who had excessive use of video game for last 2 years, and he had video addiction, like based on the criteria which we used, and excessive playing led to losing interest in studies as well as getting low academic grades. The other dysfunctions seen are self-care, decrease in self-care, then all disturbed biological function, sleep, appetite, nothing, then avoiding contact with others, behavioral changes like irritability, and when he became very angry when he was advised to stop accessing video games. This research was actually for identifying the parental distress. Of course, the child is in distress, plus we administered parents also few scales to identify their burden, their distress. The parents had psychological distress, psychiatric distress. We administered few scales for that, and they really attributed this helplessness to manage this users is the one major problem. So dealing with this video game addicts is one problem, plus dealing with parental agony, parental distress of helplessness, felt helplessness after a long period of trials. And by the time the child become an adolescent or wherein they have no control over this gamers. So that is in most of the cases, that is the challenge with the therapist. And yeah, this is just a game, just a picture, an image of a gamer. What do you think? I mean, when you think about a gamer, what sort of image you could get into your mind? Can you just imagine? This is a very, very simple picture, I think. But maybe a person with, yes, I got it, that sort of mannerisms, or lost, everything lost, or the person may be lean forward and sitting very, very eagerly to grab something, to achieve something, or the person, what sort of picture you are getting, you just think about. Yeah. So if you want to know about this gaming disorder, gaming addiction in detail, definitely you should know different types of games as such. Right? These are very, very generic terms only I have written. Specific names are there for each games, but I am not going into those details. One is free to play games. There is no condition for that. Then massive multiplayer online, that is MMO RPG, right? MMORPG games, massive multiplayer online role playing games, which is very, very similar to our real world situation, and they are creating an online environment wherein they can play with multiple players, and there are different tasks for them to attain. Initially, the task will be very simple. Later on, they may tell, I mean, they have some it's all like fighting each other, and or not only fighting, maybe they may achieve something than their colleagues, than their friends, the team. So slowly they may, you must be knowing better, I think. I don't know actually in general. I mean, in overall, I don't have much a picture of that, but still they get some tokens or points. Later on, some weapons they can buy, and because and with that, what to say, they can defeat the opponents. Therefore, they will feel, yes, I achieved it. While seeing this one person achieving achieving something, the other, I mean, the peer group also will get influenced. We don't know the families in environment of each of them. Maybe some for some $500 they can buy one weapon, but for that parents won't allow penny for that. Therefore, they may have to say lies. So see the different, or they may have to get support from any one of the parent, and again parental conflict. So all these can happen in a single type of game itself. Then another game is first person shooter games. Then sport games are there, real-time strategy games are there. So all different types of game, puzzle games, then fear imposing games, a lot of games, types of games are there. What is common in all this is nothing but reinforcement. It's all reinforcers. So where is it lacking for these people who are much involved in video games? What is lacking for them, or why are they mostly involved in this? The answer is rewarding or reinforcing. Yes. Now, this is a broader concept. See, I mean, about the structural issues in the internet itself. It's like we are all actually products, right? It is not, we are not customers, but we are all becoming products. Yeah. And few studies have shown that there are a lot of health hazards. Lot of studies are there among, I mean, about internet or video game addiction with obesity. Sitting and playing video game in one single posture, and even playing 1 hour per day, even a single 1 hour day, 1 hour video game play itself increased obesity. That is one study report. Therefore, you must understand how much it is affecting. Then a lot of other studies are there on insomnia. So this is not at all, this is not only one common consequence of or the common hazard of this video game use. A lot of other things like depression, anxiety, guilt feeling, suicidal ideas, then irritability, lot, anger. A lot of studies are there. And about the neurobiology, I'm not going into the details. The thing is, it is saying that the prefrontal cortex, similar to other substance or alcohol addiction, in all the process addictions, it is the pleasure principle. Therefore, and the areas involved are the areas for motivation, areas for memory, areas for pleasure, etc. And the areas mostly involved are prefrontal cortex, then the amygdala, the areas associated with that. This is one theory. And the hormonal, the neurotransmitter release happening in that area. Another theory says the stress produced when a person is forced stress happening, and the cortisol increase, which again lead to other health hazards plus behavioral changes in the brain itself and the person. About assessment, how to, we said all these, yes, true. I mean, there are, we could say that yes, the person is addicted, but how to assess a person who's having video game overuse? The gold standard mostly we used to say is record or quantify the problem. Person should be observed for around typical 2 weeks, and try to list what are the difficult behavioral changes observed, and based on this, better not with the awareness of the person, because that is how we will get it mostly. Otherwise, they may think, oh no, I don't have any problem. They may try to pretend. That's it. Though it is a 2-week assessment we usually says, many of the research say that is not even necessary. 2 weeks time and all is not necessary. And similar to all the behavioral addictions, 4 C's are the standard protocol for behavioral addictions, like for this video game addiction as well. One is control. C1 is control. Are you finding it difficult to control or regulate this behavior? That is, if the person is having loss of control. Second C is craving. Do you have the urge to engage in this behavior again and again? Third is compulsion. Do you have the tendency to repeatedly perform this behavior to get satisfaction, despite there is no need of it? Even though the person knows that, but person is unable to control that. Fourth C is consequences. Are you facing adverse consequences of this behavior in the form of, or do anyone annoy you, or in the form of psychological, physical, social, financial difficulties? Are you facing any difficulties? If yes to 3 or more, therefore they need a screening. That is this is the major, standard criteria for screening this video game or any behavioral addiction pattern. And though we, as I said, the typical two week category and all strategy and all is not necessary, keep a track of gaming. For gaming specifically, 1 week itself is very important. And for a parental checklist, we can say that like totally weekly how many hours, then most common time for excessive play, which is the most common time they are using for excessive play. And few questions like we can tell the parents like total weekly hours, then accurate estimate of your child's gaming time, and underestimate of your child's gaming time, overestimate of your child's gaming time. Like this way, we can tell the parents at the most how much, at the least how much, and generally how much time the child is playing video games. There are different tools to assess the screening, assess video game addictions, like excessive gaming screening tool, gaming addiction screening tool. A lot of other tools are also there. But if you check internet, it is a lot of things are available. But the the Indian culture, the culture bound scales are very less, and I think NIMANS is developing a tool for this actually. Yeah, and yeah, this slide actually I took from a presentation which I did for NIMANS during that period. Yeah, these are some some defensive strategies our kids or a person who is engaged in video game addictions might say. So we have to be beware of this. Like everyone plays it, no longer playing out in the open, but very secretly they are playing during night. At least I'm not using drugs, no. Then what is the problem? They may ask. Then when they may try emotional abuse with us. You don't love me, that is why you are not. Many of my friends' parents are allowing, but you don't love me. And again, later they may they may come and they may go to any one of the parent and try to alienate with them, or try to have a triangulation pattern. And dad, let me play, or mom, let me play. Please tell dad, please tell mom. That way it happens at home. And children may say nothing else. It's totally boring. Nothing else is making me happy. This way of defensive statements. Then maybe if you didn't act so often, I won't play this much. Why are you saying all the time? I know that. No, actually they may also feel guilty, but they are saying like this. These are my only friends. I don't have much friends. I'm not going out. Then why can't you allow? They can find some like-minded people through these games, and they say, these are my only friends. Don't worry about me. Just leave me alone. These are very, very common comments these kids or youngsters may say. And coming to prevention or treatment strategies, 3 types of prevention strategies we have to think about. When it comes to primary prevention level, prevent addictive use. That is the major strategy. Involve in game players or not, like it is mentioned that, I mean, prevention, primary prevention should always, it should not only for this video game players or over players, but it should be for everyone, raising awareness campaigns on potential signs, symptoms, risk, and ways to seek help. Many of even many people among healthcare community, doctors community, or teaching community, many of us don't know where is the limit setting, and how to seek help. So in such a scenario, the primary prevention comes as awareness campaigns, raising campaigns. Then law enforcement if possible, that is also very important. Secondary prevention, again, specific treatment, early diagnosis and treatment, target the risk group, deal with the particular symptoms if they have any. And tertiary prevention strategies includes, again, this most specific strategies, techniques, and one outcome. It includes, if pharmacology is required, of course, should go for to treat specific symptoms. And psychological interventions, it should be one-to-one and group, because group, I find it very useful in even in OPD settings also. I have 2-3 very simple, very small group, 2-3 youngsters in almost similar age, 18 to 21. I am calling them in the same day, Saturdays, today. So one to one, one after the other, like that, I am seeing them. And I find it very easy for them also. Like they may ask sometimes, because they don't feel that they have any psychiatric or psychological disorder to come and treat in OPD. Once one guy go out, the other person may ask, what is the problem with that guy, madam? Does he also have some any video addiction or any video game addiction, any problem like that? When we disclose needed material with them, they feel, oh, that is quite okay. And I conducted few group sessions with them, and they find it very helping to each other, to know each other and how it is affecting them. Yeah. Then motivational interviewing or motivational enhancement therapy, then teen groups and parent support group. These parents, they don't have much control over the mostly the adolescents or youngsters, and so parent support groups are also very useful, found to be very useful. And one outcome of the behavioral addiction study which we had conducted was the SHUT clinic, which evolved in NIMHANS based on this behavioral, to treat this behavioral addiction. It is known as Service for Healthy Use of Technology, SHUT, and it is one among the first clinic in India to deal with managed technology addictions. And a lot of video game addiction studies, I mean, cases are coming there, and doctors are referring Kerala or cases from Kerala to us also. And that is, and even in Rajgiri, they have started one clinic like this. So these sort of preventive strategies are very important when we think about prevention or treatment modalities. Other than that, if we say about the specific treatment and strategies, one is modeling, which is very, very, very important, because nowadays children are modeling us, parents or teachers or whoever, and we all are all the time with mobiles or with internet facility only. So the healthy use modeling is very important. Then assertive communication, non-judgmental. When we talk about assertive communication, non-judgmental communication is mandatory with these children. You are like this, you are like that, assuming and talking, no, it won't work out with them. No passive or no aggressive treatment also won't be effective. Then adopting total, another treatment, confusion is always as in even in smoking cessation, people may which strategy are we focusing, like adopting total abstinence or moderate use, focusing on moderate use. Like some they may say, oh, all of a sudden how can I stop, therefore shall I cut the time slowly, or should I stop completely? So this which treatment plan are we focusing is very important. Both plans can be both are workable plans based on proper monitoring with a therapist. Then implementing crisis intervention, CBT, and family interventions. These are very specific strategies for internet video game addiction. And as we know, no one is talking about prohibition of internet, and which is actually a joke, right? We cannot say it is possible, and therefore that is an issue for again scope of this scenario. Only thing, we should accept and have firm control mechanism. Should have firm control mechanism. How? In families, you yourself focus on limit setting. You should understand, it is not a constitutional right that we are supposed to use internet or video games. So how much time one person should use internet a day? Like maybe for students, we can give like a strategy, like 1 day in a working day, 1 hour in a working day, 2 hours on holidays or weekends, and other days or vacations, plan vacations with activities. This way, plus maybe 1 hour again, or in after 1 or 2 days after. This way, or some limit setting strategy should be there. Another thing which we can implement is password. Why playing a game should have a password? Why children? I don't know whether you people also will accept for that. Your personal phone should have a password which no one should know. That is what everybody will be thinking. But still, if there is a game which we can log in with this particular ID, why it should be secretive? Family should be aware of that game code and all. So this way, a few limit setting strategies can be implemented, very core level. And yeah, there are two terms I have written here: replace and reward. What is that? Replace video game technique or video people who are trying to spend much time in video games with some other activities, creative activities, joint activities, plus reward, proper reward. See, as we said, reinforcement or proper rewarding is the most important thing in all these internet video games. So proper reward, where is it lacking? Find out, give it, or try to get it through other creative activities. Now, future of this trend, which is the topic, or which is the heading of my presentation, which is still questionable, because now we are not only talking about, like, everything is through internet. That is the current scenario, and hopefully maybe in the next Olympics also we should foresee that we will be seeing through internet, right? Not only seeing, it will be played through internet. So a lot of esports have emerged even now itself. Therefore, where are we going, and what is the future of this video game addiction? We should be beware. Times will change, and so let's tune what's going to happen. Let's see, right? And I would like to open this session for a wonderful discussion about this. Thank you.
Thank you so much, ma'am, for giving your valuable insights on this topic. Please excuse me as I'm not able to on my video since there's a power cut in my house. Yeah, let's move on. Next is a question answer session. I request all participants to drop your queries related to the topic discussed in today's webinar. There's a question. How can gaming be used as a stress reliever? Question is asked by Anu.
Stress reliever. who says it is a stress reliever? Nobody is saying that gaming is a stress reliever. Though we feel it is actually a stress inducer. It is not at all a stress reliever. But there are some games with some positive effect. There are people are saying, like maybe some family games like playing Ludo, or some games are there which can be played without any attaining task, or any getting some what to say, grab need of some competency, or to grab some competency, things like that. So it is playing games is not at all a stress reliever. That is point number one. And it can be used as maybe as temporary time, what to say, an engagement strategy, maybe for maximum half an hour. Beyond that, and the game chosen is also, it should not be fighter game, it should not be a fear-inducing game, it should not be any other such competent games. This has to be taken care. Yeah, I don't think it is a stress reliever at all. Plus, another, I mean, few what you call, yeah, working memory games, or games particularly for cognitive ability enhancement. Such games are there. But that also, with the help of a therapist only, you can use. I think Pearson have developed a lot of games like that. But other than that, I don't think games are stress relievers. Yeah, these are stress inducers. Yes.
Okay, ma'am. Angel ma'am has asked a question. How long it take to become an addiction?
The criteria itself is, if a person has these symptoms, which we said already, four C's, or we can say preoccupation, consequences, withdrawal, tolerance, all these comes under this 4C. If the person has any of these, or three or more of these conditions, definitely for a period of 12 months, we are saying that it will become an addiction. But monitor for 1 week. If it is continuing, definitely we should seek help. That is the strategy in all research showing. I hope it is clear.
Yes, ma'am, it's clear.
For, yeah. Though it is
The
a 12,
next-
12 month, if it is for 1 week continuous, it is a problem. Yeah. Please.
Okay, ma'am. The next question is, does every game can be called as an addiction? Some spend their leisure time and some take it as a career. Can we say it as an addiction? But why the society name it as an addiction thing? Question is asked by Manu.
I expected this question even before. Even that's true. As you said, there are a lot of game developers, and there are a lot of creative games are coming. Therefore, how can one say that? I mean, in general, how can we say that it is all addiction? See, I would say the age category which we say they are addicted, and when we see the research, around 18 to 60 between. So the youth is the category who are playing much in these games, and we should understand the neurobiology of these youth brains. It is not properly it may not be completely developed, number one. Number two, the tolerance, or the craving, or the tolerance symptoms, or the brain tolerance, the pleasure which brain gets, which will definitely leads to addiction in many conditions. That is why, as you said, even I mean, a lot of good games are there, and good developers are there. Yes, of course. Many of these conditions are nowadays considered as even behavioral addictions. You should understand, it should come under other addictions also. It can come work addiction, or exercise addiction, like that. A lot of addictions are there. It can come under some other addictions also. So we cannot say, oh, yes, all the games, but the choice, our brain may not be that much wise for decision making when the circuit involved in it is complex, or when the circuit involved in this is involved in this process. The motivation circuit, the decision making, then the memory circuit, all these are involved in this neurobiology. Therefore, there is a deprivation in decision making. That is how it will become a problem.
Yeah. Am I audible, madam?
Yes, sir. Please.
Yeah, thank you for the wonderful session. Contemporary, very relevant, even for the parents and in all age groups. See, let me ask one question about the nowadays. Some of us have a view that certain games help the children to develop the visual spatial cognition and psychomotor skills and all.
Correct.
What about your opinion on that?
Yes, so that's what I said, that few games have developed based on proper research by neuroscientists, and they like working memory games, attention enhancement games are there, which are definitely useful, but it should be given with a proper coach, with a proper monitoring mechanism about the time using for that. Because otherwise, what will happen? The time using is very important here, because though the visuospatial or other cognitive skills may be improving, but at the same time, other areas, whether the other areas are impaired, that is the thing which we should understand. So
Thank you,
in
thank
one
you.
way it is good, but whether there is any impairment, we should take it.
Yes.
Ma'am, there's one more question.
Please.
Is there any games which help to increase cognitive skills?
Cognitive skills, yes, there are a few games, I know personally about Pearson's games, Pearson's working mem. That is why I repeatedly said, because I am a certified coach for that, and I use that with many children who have cognitive deficits, many children, and they have developed a lot of games for even adult group also. One thing. Two, there are some games developed by Happy Neuron group, that they are also very good for cognitive skill enhancement. Yeah, these are the two authentic things which I can say now. Yeah.
Ma'am, the next question is.
Sir.
Let me ask one more question about.
Please,
recently, 3 or 2 days back, we had a news from Kottayam about the suicide of one young man. I think it was a student, I hope. What about your opinion about the gaming addiction and its suicidal tendency?
Correct. Yeah, actually, I didn't mention the word suicide itself in the slides, because I thought let it come as a discussion. Yeah, anyway, thank you, sir, for raising that. Suicide, it is, and we should understand it is nowadays, for last 1 month or so, it is highlighted in media a lot. But one should understand this is happening every time. It's not only because of this. And now, about a person who committed suicide because of involved in gaming, we cannot say that whether that person, we don't know whether that person's suicidal cause behind that was just gaming itself, or any other factors are also involved. What we should understand is the consequences of gaming addiction as one, depression. It can lead to depression, it can lead to anxiety, it can lead to helplessness, hopelessness feeling. We don't know whether the person might have borrowed money to play further. So we don't know whether he has any debt. So a lot of conditions are there as risk conditions which have to be addressed. So just saying, video games lead to suicide, no, the factors involved, the psychiatric, the psychological distress components involved need to be addressed properly. The person might have not reached that stage if he might have seek help early, number one. Number two, or if he might have been annoyed by somebody, we don't know all these factors. So these are all components which we should be aware. Therefore, awareness campaigns are very, very relevant about this.
Thank you. Thank you, madam. Thank you.
Ma'am, the next question is, how can we make a person understand that he or she is addicted to social media? Question is asked by Jitin. Oh, sorry, Ria.
Yeah. How can we say that a person is, how can we tell a person that person is addicted to social media, right? Yeah. Here, again, the time, whether the person is even, we used to say, no, even during eating, even during every time, are they totally with phone or with, even if there is a single notification, immediately the person has to see it, or how much time the person is spending, whether the person is having sleep disturbance because of that, whether the person is completely spending a lot of time in during night for that. These all are the factors. Therefore, again, see this 4 C's: control, craving, compulsion, compulsive use, and consequences. If any of this area or 3 or 2 or plus itself can be a warning sign. You can tell your friend, you can tell your that person that, see, this is going to be a problem. You should set limit. It is not like you should stop using it. No, nothing like that. You should set limit. Yes.
Okay, ma'am, there's one more question. FPS games helps in quick decision making. So, ma'am, what's your opinion?
Okay, again about favoring video games, right? All right. See, first of all, I would say I am not specifically which all games may help, which all games may not help. No, so I'm not going for that debate. But as you said, yeah, certain games are there. That is what I answered for the previous question also. Some games are there which can help for cognitive enhancement skill. All right, but how? We used to say a wise decision from, wise device used by wise brains. That is the answer, I would say. How much time, how effectively, and for what purpose are we using it? All right. Even if it is a very useful game, time limit is very important. Yep.
And there's one more question. How should parents deal with kids constantly deflecting the claims that they are addicted by telling that it's the only way they get to talk to their friends in COVID time? Question is asked by Sharu.
All right. See, yeah, these things actually, I should have said in the presentation, so that COVID might have restricted all of us, and we might be thinking that this is the only way we are able to connect with our friends through online, playing playing with like-minded people, or this is how people are saying, and parents find it very, very, very difficult. And I know, I think this is not a parent group also. So I am telling you youngsters about how to, what to say, what your parents should say about this. Anyway, you are a upcoming therapist, so I can say this very well. So here, few things one should understand. Family, internet use, I'm not only about video games, but overall internet use, there should be set norms at home. Parents should be the control mechanism, not youngsters, not children. Parents might have approached youngsters, for maybe ordering a Swiggy, or ordering a online shopping, things like that. But that doesn't mean that they don't know things and you are the one best decision maker for internet. No. I would say parents should be aware about this. And second thing, parental digital literacy is the most important thing we should focus. each parent, of course, it is very, I mean, maybe in remote areas and all, and parents who are illiterate also have difficulty. But the way we attained literacy in Kerala, the similar way, it may be maybe a 5-year action plan, whatever, different preventive strategies should be there. Primary prevention methods should be there to make parents aware about it. I mean, digital literacy, one thing. Second thing, ask them to seek help. Ask them to seek help from technical experts about how to use security measures about this, or how to know what game your child is playing. Such security measures can be downloaded or can be used in your phones and all. So those things, parents should get help from experts. Yeah. Did I answer your question? I doubt.
Yes, ma'am, it's clear.
Okay.
The next question is there a role of media psychologist in preventing or controlling social media or gaming addiction? Question is asked by Kessia Thomas.
Okay. Is there a role of media psychologist? Right. I would say as psychologists, yeah, of course. I mean, those who are working in specifically in this area should have a definite role. A social responsibility should be considered as a social responsibility, I would say. And nowadays, it is coming like, see, a lot of even sexting and projecting female negative pictures of females, and involving in sexually related behaviors are also coming. So again, literacy about this is very important, and that can be one aspect a psychologist working in this area can focus. Then even more than that, I would say the policymakers have a very definite role in whether to ban certain things, whether to how to make a control mechanism. Yeah, that, I mean, in a few countries, I think FB or Orkut was banned, or FB was banned, like that. So there should be a control mechanism for few things, and without that, I don't know how much all these will be useful, because you all know PUBG is banned, right? How many of your friends, or how many those who know you are still playing PUBG? Just think. So without complete banning, it won't work actually. But as mental health experts, definitely we have a role. Those who need help, we can help them with with telling the proper consequences, or the addictive behavior, the way it become an addiction, all these things. Yeah.
Thank you, ma'am. I guess we have covered all the questions. Yeah. And the feedback form has been shared in the chat box. I request all participants to fill the feedback form provided in the chat box to receive your e-certificate. Now I call upon Serene Fernandez from first year psychology to propose the vote of thanks.
Am I audible?
Yes, Serene, you're audible.
The essence of all beautiful art, all great art is gratitude. Good evening, everyone. I am Serene Fernandez of first year BSc Psychology. It's my immense pleasure to deliver the vote of thanks for this auspicious event. On behalf of Christa Jyoti College in Management and Technology and Psychology Department, I thank God Almighty for His blessings and allowing us to conduct a successful 9th session of the Sci-Hub International Webinar Series. I would like to thank our Honorable Principal, Reverend Father Joshi Chiramkuri CMI, for his constant support and guidance. I also thank Dr. Verghese Anthony, Vice Principal KCMT, for his encouragement. I extend my sincere gratitude to our speaker of the day, Ms. Divya K. Thomas, Clinical Psychologist, Rajagiri Hospital, Kochi. Ma'am, I'm sure that your words have been very informative to everyone. Thank you for your time and effort for this session. Special thanks to our HOD, Dr. Angel Thomas, for giving us this wonderful opportunity. I would like to thank Goldie for leading this webinar and Selsha for the prayer song. I also thank Neha Mary Abraham for the guest introduction. I would also thank Ms. Luna Johnny and Ms. Kriba Dina Matthew for coordinating the session. With deep sense of appreciation, I thank Jidin and Jacob from the technical team, and I thank Mr. Sijo Jacob for the brochure. I sincerely thank each and every one of you for attending this event. Once again, thank you everyone. Have a nice weekend.
Thank you, Seren. We have come to the end of our webinar. Thank you all. We appreciate